You are watching McLaren Port Huron Today's Health, and in this segment I'm speaking with Dr. Vasken Artinian about the importance of sleep. Dr. Artinian, thanks so much for joining us today.
Thank you for having me.
So tell us, why is sleep so important?
Well, as you know, we spend approximately a third of our life sleeping, so sleep is considered to be a very important element in our life. I would consider to have a good health, you need to have a good quality and adequate sleep. In fact, if we look at the most important factors that we need to maintain a good health, I'd like to mention at least three factors. First is exercise, right? Second is nutrition, and the third would be obviously sleep. Sleep is very important, and it's not a benign process. There's a lot of biologic activity goes on during sleep. During sleep we have restoration of energy. The body restores its own energy. The brain tries to get rid of a lot of toxic material that accumulates during the day. And the brain nerves, I would say, they make certain connections amongst each other, and that will be very important in establishing a good memory and a learning process. Not to mention, the replenishment of certain body proteins, protein synthesis, tissue repair, and production of certain hormones such as growth hormone. All of this go into somebody's favor. So sleep is very important. The bottom line is that sleep is very important.
So let's talk a little bit about sleep disorders. Can you tell us what the types of sleep disorders are?
Actually, we have at least 70 or 80 sleep disorders out there, but the international classification of sleep disorders have classified it into mainly 7 different categories. Just to quickly go over these categories, the first category would be insomnias. The second category would be sleep breathing disorders. Another category, the third category, is central hypersomnia. We have also the circadian rhythm disorders. Another category would be movement disorder. And the last category would be, of course, parasomnias. So these are the main categories, and anytime we see a patient in the sleep center, we try to categorize the sleep disorder and move on.
So when we talk about sleep disorders, are there other medical conditions that can become the result of a sleep disorder?
Of course. Sleep disorders are not benign. Obviously, they have a lot of implications, and they cause a lot of medical problems. But the most common disorder, which is sleep apnea, this is the one that we see most of the time in a sleep center. Sleep apnea, other than causing a lot of tiredness and fatigue during the day, problems with attention, concentration, and memory, it has other health issues such as hypertension. It's been closely associated with hypertension. It can cause issues with coronary artery disease, congestion, heart failure, stroke, and most importantly, it's closely linked also to development of cardiac arrhythmias, most importantly atrial fibrillation. If we pick another sleep disorder like insomnia is very closely linked with depression. You don't really have to have a sleep disorder to have a medical problem. Sometimes being deprived from sleep, it can lead to a lot of medical complications. Like sleep deprivation by itself is it's known to cause a lot of problems such as anxiety, depression, issues with performance in school, performance on the job, issues with metabolism, disturbance in your weight hormones. So we can also talk about impaired or lower response towards infection and viruses just by the fact that you're sleep insufficient or sleep deprived.